My name is Elizabeth Njovu with Texila American University. I'm the first year student. The topic for presentation today is factors influencing healthcare providers' compliance to infection prevention and control guidelines at St. Dominic Mission Hospital, Ndola, Zambia. Specific place is St. Dominic's in Zambia. Factors affecting infection prevention and control compliance. According to my research, I discovered that providers and especially nurses will affect infection prevention. Limited and detriment will affect the infection prevention. Overcrowding, most of our hospital clinics, our health places are overcrowding with patients. That also will prevent, because it will to control the movement of people. Overwork and staff shortage. Because I'm alone on duty, I feel tired, I feel overworked. It will be difficult to move from one place to wash my hands or to follow the guidelines for infection prevention. Inadequate finance, because the funds are not enough to purchase it I need for infection, so it is compromised. Inadequate equipment and material due to inadequate finance, as earlier alluded to. Adequate knowledge, most nurses about infection prevention when they were still at school. So there's need maybe to do some fresher course, whatever, to give health workers enough. So what? Those were the findings. I thought this research will provide data on the factors appliance to infection prevention and control guidelines as those working at St. Dominic Mission Hospital in Zambia. This will then help to reduce the occurrence of infection that are from non-compliance practices. According to the background, I was able to discover that compliance infection prevention and control is a major problem worldwide, especially in developing countries, my country, Zambia. Risk of health-associated infection. Imposing avoidable suffering that could be avoided, absence, long hospitalization, disability, and sometimes even death. It also increases cost on healthcare system and affect economy of these patients. They become, hence the economy somehow affected. Healthcare associated infection in developing countries includes of infection prevention and control among those people I interviewed. And because I wanted to see what is happening, I was able to refer back to 2012, what was happening in terms of what are the recommendations. I'm saying despite participants' knowledge on infection guidelines, needs to be encouraged through supervision and having departmental meetings. Hospital administrators should encourage capacity building in infection prevention and control. The Ministry of Health should support and fund more research on infection prevention and control. What are the that I am intending to take? Following up research findings. I have the findings in this research, and I'll make a follow-up to ensure that we comply as nurses to infection prevention. Ensure that.
Thank you, Ms. Elizabeth, for your presentation. I welcome Ms. Ikija for the presentation. It's my pleasure to invite you. Now, dice is yours. You can take the control.
I'm I'm here to present the social cultural factors affecting client participation in health education programs in Omar Sanda General Hospital, Bida, Niger State, Nigeria. The summary of the research work was conducted at the General Hospital to understand the social cultural factors that affect client participation in health education programs. We know the health education has been defined by different authors and experts about what health education is, and at the alma mater Declaration of Primary Healthcare in 1978, health education was seen as one of the components of primary healthcare, and it was organized as a fundamental tool to the attainment of health for all. Adopting this declaration, World Health Organization neutralizes the recommendations of health education as a primary means of prevention of disease and promotion of health. Even though the people know the importance of health education, it was observed that some cultural and beliefs of people that make them to resist or easily accept changes that is brought about by health education. Health education is expected to promote certain cultural activities that is of health benefits and discourage and eliminate those that are not. The expected behavioral changes that accompany this health education may be resisted by some, either due to consciously or unconsciously, and it can be due to their perception about the health education and about health phenomena. Like, take for instance a community that prides itself on the ability of their women to deliver at home. They see it as a normal, so they tend to resist any health education, anything that tells them contrary to that. That's like telling them the importance of the women delivering at the hospitals and going for antenatal care. So they see this as a deviation, deviation from their ancestral belief, from the practice of their forefathers. So they tend to resist this. So it was also observed that religion play a great role on the life play a great influence on the lifestyle of the community, including their health practice and belief of individuals, which was shown from the data collected, where 84% of them agree that their religious consideration in health education will make them to participate more in health education. The importance of this research work will help to look into and provide adequate information about health education in this area of study, that's bigger community. It will help to discourage cultural beliefs that make the effect of health education fruitful. It will help the researcher to get more knowledge about health education and will uncover problems hindering the clients from participating in health education. So what? The modern health perception has changed. We know that modern health perception has changed from from curative to preventive. But some developing countries are still facing the challenges of this, including Nigeria. They are still battling with the ignorance that is not merely related to absence of awareness campaign, enlightenment program, or health education, but the resistance and lack of interest in participation in such programs by individual groups and communities. This lack of participation may be related to their social cultural practice embedded in a particular race or community. So, and the people, we know that health education programs are not worth holding if the people who the health education programs are not ready to participate. Then it was observed that majority of the people in the community still practice harmful health practices. Like some of them, they believe that when a child is having convulsion, that it was caused by an evil spirit, and for you to take away the evil spirit, you have to put the child under a frame. heating the body. Did you know what causes the temperature to that? What causes the convulsion that is can be as a result of the increase in body in the temperature. So they also go ahead and do cultural practices that are contrary to health. And in view of this, when the health education programs are organized in the hospitals, either during antenatal visits or during when they come for immunization programs, they deliberately avoid the program by coming late. The importance and relevance of this research work is to help the nurse to understand the culture of the community, the negative aspect of it, how best to educate the community on the dangers of such practices and the such practices on their health. So from the data obtained, I'll be able to direct, get the major reason why the clients don't like participating in health education when they come for hospital visits. And this information will help me to overcome such challenges and encourage the clients to participate. Because of the shift from curative to preventive healthcare system, the hospital organized the health education programs where clients will be educated on issues relating to their health, but it was discovered that they are not actively participating due to major social cultural factors. Majority of the people see hospital as a place meant for the sick people, and they refuse to participate. Their religious belief, some of them believe that sickness comes from God, and so they have no effect over it. So there is no need for them to participate in the health education. For example, it was observed that the hospital has high record of children that present at the hospital with protein, energy, malnutrition, and these children are between the ages of 2 years to 5 years. And to combat this, the pediatric department with the community health department plan a food demonstration class for the women to teach them how to use the locally available food to prepare a balanced diet that will meet the nutritional need of these children, and also create opportunities for the nurses to monitor the developmental milestone of these children. But the percentage of the mothers that come for these classes are not are not commensurate with the number of women that come to the hospital. So that was what motivated the research to conduct this research work. The method of the research design was a descriptive research design, and the study population was the people that the clients that use the hospital, the Umaru Sanda Hospital. The sampling technique was a simple random sampling, and the total number of 50 clients were randomly selected. The instrument of data collection was questionnaire. The method of data presentation and analysis was done using a descriptive statistics of frequency distribution table and percentage. The research results and discussion. From the research discussion, it was observed that all the participants were adults between the age of 21 to 35 years. Majority of them are the majority of them are male. That's 52%, 48% female. The 32% of them are farmers, while 30% are business people, 25% are civil servants. The majority of the trying to find out the level of the client participation. The 80% of them strongly agree, and 20% also agree the importance of health education. Invariably, that signifying that they all know what health education is, and all of them they disagree that there is no need. None of them disagree that there is no need for them to attend health education in the hospital. The 80% of them also agree that they would like to attend health education program when it's organized, that they also agree that whenever they attend health education programs, their beliefs are not, that's about 44% of them agree that whenever they attend health education programs, their beliefs are not considered. And this is what discourages them from attending the health education program.
Sorry for the interruption. You have 5 minutes left.
Also,
you kindly ensure that you are completing within 5 minutes your presentation. Thank you.
The 30% of them also agree that they don't participate because their religious leaders were not informed, and because they also believe that the sickness comes from God, so there is no need of them attending. Whether they attend health education program, if God gives them illness, that illness must always come. So they don't see that they have no control over illness. The importance of the findings to nursing profession is that the findings will have a significant. The findings have significance to nursing profession in the following ways. It will help the nurses as a health professional should consider themselves integral paramount in the dissemination of health information. The nurses should, accordance with the findings, be abreast with the fact that those who don't participate in health education only need more enlightenment. The findings reveal that nurses should consider people's belief in while organizing health education. In conclusion and crucial step, this study was conducted to assess the social cultural factors affect clients' participation in health education. The study showed that clients are aware of health education and are willing to participate in health education if proper channel is followed. But being that Nigeria is a religious country, majority of them want their religious leader to also be involved in health education. This is why the federal government also use religious bodies and traditional rulers when they are flagging off immunizations.